Hi, Cindy Warmington coming to you after the May 19th Executive Council meeting. A lot of important issues that were discussed here today. Well, starting with homelessness, over the last 2 weeks we've been talking about a contract that we tabled at the last meeting. We spent a lot of time with the Department of Health and Human Services working this through, and it turns out there was an anomaly in the budgeting process so that the budgeting for fiscal year 22 and 23 was based off of an abnormally low number, and the result was $862,000 in funding was cut from the budget for fiscal years 22 and 23. I think we've impressed upon them the importance of getting that money restored and what a difference it's going to make for our homeless shelters, and we're going to keep working with the department on this issue. So we also talked about a contract that will use an outside contractor to resolve some of the backlog that we're experiencing in the Department of Health and Human Services on licensing applications. And this is important because we have the backlog now, but also I wanted to be sure that this independent contractor would not be a replacement for our state employees. We are going to continue to recruit for that position. We are going to fill that position. We are going to keep that knowledge and that level of expertise in the Department of Health and Human Services and ensure that this independent contractor is really used to address the backlog and then to be there as a backup once we've completed the hiring process. And we talked again today about the emergency room boarding issue. We have, as of yesterday afternoon, 36 adults and 24 children being held in our hospital emergency rooms. Since our last meeting, the New Hampshire Supreme Court issued a decision, and no one can be held involuntarily in our state without a hearing within 72 hours. Right now, the state is not in compliance with that order. I understand and appreciate that the Department of Health and Human Services is doing everything in their power to come into compliance. But honestly, this is a failure of our governor. He's been in office for 4 years. He knows what this situation is. The legislature funded the money, provided the money for this to resolve this issue, and the governor simply hasn't done it. It's way past time.